We have our international guest here, but to give you a better idea about why they are here, what is being achieved, and what do we want to achieve going forward. I have with me.
I want to thank Dr. Joshipura to introduce me. By the way, we are classmates, so we know each other for last 56 years. We're born and raised, so this is like coming home for me. Currently, I am the chair. Now, as you know, AAPI is the second largest medical professional association in America. So after American Medical Association, AAPI is the second largest association of all the physicians of Indian origin. Now you can understand that we all studied in the medical school, the allopathic medical school. We went there, and now because what is going on in America in the healthcare field, because the healthcare cost is going so much, there are so many complications also with the allopathic medicine. We have started.
You need for the policymakers, and how you are going to put up the paper after this meeting.
As I said, we have three main goals: the academic or education and training, number one. Number two, the research. Number three, the quality product development. So these are the three fields we are talking with policymakers. I think there needs to be, on an educational level, there needs to be a proper accredited integrative medicine curriculum where allopathic physician as well as Ayurvedic physician can learn about different sciences. So when they are practicing out there, they are aware of each sciences and where this integration can occur. It's not about pathis for us, it is about patient. Because if we keep patient in the center, we keep patient well-being in the center, all the silos, all the department, compartment, pathi discussion probably should dissolve. Because I think that is what is guiding us, and that is what we are talking with a policymaker to start integration. Number one, we still think that a licensed physician should spearhead the care of the patient, number one. And if we keep the safety of the patient as a first priority, we need to regulate at a state level or national level whatever changes needs to occur at a policy level, a proper accreditation, compliance with the quality product, proper integrated curriculum. And we are here, Dr. Charles Elder is here, that we will be sharing what we have done in United States. MIU, which is Maharishi International University, has created this integrated or integrative medicine fellowship where Ayurveda is part of it. Something like that can be replicated here, as well as there could be exchanges between two countries, because we think that Ayurveda, the land of Ayurveda is still India.
That's right.
And we need to learn a lot. So there is an exchange of real Ayurvedic knowledge should go to America and practicing physician there, and we can share our experience.
પણ તમને લાગે છે કે યુએસમાં વિઝા આટલો
In America, all Americans actually gets benefit. You all saw that in last 15-20 years, the yoga has been adopted in American life. We also think that along with yoga, Ayurveda also has a tremendous relevance currently. And we are not talking about passion or emotion or because of our heritage. It is because Ayurveda works. It is relevant. And with that knowledge, which I had an opportunity 12 years ago when I was practicing only allopathic medicine, and when I saw benefit in my own personal life, I saw a light, and I then educated myself into Ayurveda. There is also in America a special integrative medicine board has been created. In the integrative medicine board, there are a lot of other modalities also, like homeopathy, acupuncture, Chinese medicine, botanical medicine, and Ayurveda is becoming one of the important tool in the integrative platform. So he has been also trained in the medical school, Boston Medical School in Boston, Massachusetts. He had also a training in internal medicine, but then he also had exposure to the Vedic science, and he has been integrating the Vedic science in his practice for last 35 years. So we are so fortunate. I feel so proud and privileged that I was able to convince him to come to Ahmedabad, speak to allopathic physician, Ayurvedic physician, policy makers, primarily our Indian Medical Association physicians as well as Ayurvedic physician, and we want to create an integrative model of healthcare delivery so that ultimately we can learn from each other and patient gets benefit, number one. Number two, we also think that by integrating Ayurveda into the modern medicine, because it focuses more on prevention, lifestyle, dinacharya, yoga, meditation, it is going to reduce the healthcare cost. And we talk about healthcare cost. In US, healthcare cost is 18% of GDP, which is equal to defense budget. In India, I was researching, healthcare cost also is increasing. In last 2 years, it has increased 10%, healthcare cost. So I think the need for our Vedic science to be integrated as a part of modern medical practice is not about just emotion, and not it is about that it is our heritage, but it is a necessity of our time. This is the time where we need to start integrating so that we can focus on prevention, lifestyle modification, and reduce the healthcare cost. So that is one of the reasons why we have started this initiative.
પછી ડૉક્ટર્સને ત્યાં અવેલેબલ થશે અને શું આ લોકો જઈ શકશે?
અત્યારે 2-3 વર્ષ કદાચ એ ડિફિકલ્ટ થાય. Personally, I think that with this difficult 2-3 years of phase, things are going to open up. I'm not worried long term. I'm worried maybe short term that they are trying to restrict here and there. But I think the knowledge and power and relevance of Vedic science is so much that even though some countries might create some hurdles here and there, we are very confident. You talk about BAMS physicians. When the BAMS physicians come there, we want to create an atmosphere where Ayurvedic science can be properly also implemented as a part of integrative medicine practice.
ઓકે,
So yes, short term
Okay.
there could be some issues. Long term, I don't see a problem.
ઓકે, ઓલ ધ બેસ્ટ.
So he has been also trained in the medical school, Boston Medical School in Boston, Massachusetts. He had also a training in internal medicine, but then he also had exposure to the Vedic science, and he has been integrating the Vedic science in his practice for last 35 years. So we are so fortunate. I feel so proud and privileged that I was able to convince him to come to Ahmedabad, speak to allopathic physician, Ayurvedic physician, policy makers. summit, we had a representation from Indian physicians across the globe, from Australia, New Zealand, Europe countries. So we had this medical conference, but in the medical conference, for the first time, we had a half day dedicated to Ayurvedic science. And for the first time in that sense, that the allopathic physician groups are opening up, and that is our one of the initiatives that our through these exchange conferences, workshops, and seminars like this, we want to educate, exchange ideas with allopathic physicians why they need to learn about Ayurvedic science. So we had, as I said, discussion in Orissa, 3 days, and then from Orissa we are here. So this is our second stop, Ahmedabad, naturally. Ayurvedic compounds in United States are over the counter. It doesn't need prescription. So therefore, the only thing the Ayurvedic compound has to pass through is a simple FDA registration process, not necessarily clinical trials. But because it is available over the counter, the recommendation can be coming from the practitioner like integrative physician, or I have actually a BA/MS physician working under me or as a part of my practice, because I have a license to practice in a particular state, and I can include BA/MS under our license of our practice.
We learned about Ayurveda, and we began to practice Ayurveda, incorporate Ayurveda into our medical practice. And there we go. And we've had a wonderful experience. And our mission at MIU, Maharishi International University, is to transmit the knowledge of how to use Ayurveda in coordination with allopathic medicine to the best benefit of the patient. And we come here to recruit recruit fellow collaborators to work together. This is a big job that we have ahead of us.
What are the take?
Hi, sir.
Hi.
Good afternoon.
Good.
So, how you feel about Ahmedabad and the visit?
So
How was the
I
food?
think if you can share like how you were exposed to Vedic science,
Yes.
and that will be very helpful.
So, okay, it's very good. This is Dr. Charles Elder and my wife, Dr. Leslie Elder. We're here from Maharishi International University, and it's a great honor to be here with you. And to answer the first question, we love Ahmedabad. People are wonderful, and the food is delicious. We're really enjoying it.
Yeah, enjoy the food.
We're greatly enjoying the cuisine. So we first learned of Ayurveda in the United States from our exposure to Transcendental Meditation, the Transcendental Meditation program. When I was a pre-medical student, I was under a lot of stress, and I started looking for some way to manage the stress. And I learned a lot of different techniques and yoga, this, that. But it seemed that TM, Transcendental Meditation, was what stuck. This is a Vedic meditation technique that was brought to the West by Maharishi Mahesh Yogi around 1960 and is now internationally popular. So Ayurveda is natural in India, very deeply rooted. You don't have to worry about it going away tomorrow. In America, it's new. And part of our purpose in coming here is to connect, because we need the support of the Ayurvedic community in India, because we're very few. And it requires constant energy to grow our program in America.
So, what type of treatment you need there? Like the meditation, you need it.
Yes.
What else?
Oh, well, it's a lot. Okay, just the science of the daily routine, the dinacharya. There's very little knowledge of that that's been forgotten. to a large degree in our country. The daily routine, the way of eating, the eating lunch is the main meal of the day, that kind of thing. It's really been completely, that knowledge has been forgotten. So that's really important. And just diet, the fact that certain people need to be on certain diets, the Vata diet, Pitta diet, Kapha diet, the concept of ama, impurities in your system, and how a lot of most diseases caused by ama, the impurities, and how to get rid of that, what you do, the ama pachana, which is the burning off the ama, getting rid of the ama. And all these treatments, and also the Ayurvedic, the traditional Ayurvedic formulas and benefits you can get from those. There's a lot. And aromatherapy, there's so many modalities that Ayurveda offers.
Understood, yeah. So the R&D department will be there in US?
Again, it is a collaboration because a lot of Vedic or Ayurvedic compound dravya knowledge would be here.
Yeah,
We will need a tremendous expertise, and naturally we will need, if we are doing something in US, we will have to work with the regulatory authorities there. So R&D department will be a collaboration, naturally.
One last question.
Most of the Ayurvedic products being used in the United States are single herbs. Herbs like ashwagandha, brahmi, turmeric, ginger, and the like. And most people using these herbs don't recognize them as Ayurveda. They're herbs.
Yep.
The combination products that are, Chavan Prash, Triphala, things like that, people use them, but it's a much more restricted.
On a scale of 1 to
And students here and with our university and universities here.
Has an agreement been
regarding
sorry.
in America, then we have HIPAA compliance.
We need to train physicians in the United States to understand Ayurveda. That's the bottom line. And we need resources and collaborators to do that, because today in America, it's not possible for people who are not licensed practitioners to practice Ayurveda. So we think that we're very confident that the best road for Ayurveda is to teach physicians about Ayurveda, medical doctors, who then learn to integrate Ayurveda into their practice, and in this way the consciousness around the practice grows.
So how it is different?
What I wanted to say, we're working with our fellows, doctors. We're training the doctors, and we have a couple of Vajas, Ayurvedic Vajas, in the area where we're teaching, that they help us. But we feel like we need more rich resources, which we can find here in India, who will collaborate with us, and because this is the land of the Veda. We want to be authentic. We want to teach authentic Ayurveda, and we feel like you have that here, and this is what we're interested in, and we want to be able to share that with our fellows and make it a better experience for them.
how is the government
Under negotiation. And it's going back and forth, and my understanding is that it is close to being ready to sign.
And sir, who are the people you have met today?
What's the question?
Who are the people that you have met today? The people who are in the session.
So, as I mentioned, 3 days ago we were at a Global Health Summit in Bhubaneswar, where the Secretary of Minister Ayush, Mr. Koteja, was there. Then a lead research person, Mr. Patwardhan, who also has written quite a bit books and published a lot of research. He was there. AAPI president was there. The Bhubaneswar local community, because this was done at KIMS, which is a Kalinga Institute of Medical Science. So their leaders, the allopathic physicians, were there. So this is like a first of its kind, where allopathic physician community is taking the initiative to integrate Ayurveda into the modern science. There is a lot of work to be done. It's a slow process. I understand it's a complicated process too. And we just want to work with like-minded people who understand the importance of holistic, integrative approach for the well-being of the patient.
To stick with quality suppliers, because while 1/3 may be problematic, 2/3 are not. So it is not difficult to find good products if one is savvy and smart. So the clinician needs to understand the supplier, understand what their quality controls are, and direct their patients accordingly. The bigger difficulty is with the reputation of the medicine, because this has been used to taint the Ayurveda's reputation. So I think the solution, it's blown way out of proportion, and the solution, I think, needs to come from continuing to improve awareness of the benefits of Ayurveda, because really it's not the appropriate focus.
Ayurveda,
University you have in USA for the Ayurveda cannot.
So what was the question, please?
How many universities you have?
How many universities teaching Ayurveda?
Yeah.
In the United States, the largest, by far, MIU, Maharishi National University, is by far the largest center for Ayurvedic training in the United States. And there are one or two other universities who have some degree programs. MIU is the big player.
There
Okay.
is a California College of Ayurveda,
Huh.
which is on the West Coast. There is also a Ayurveda Institute in North Carolina.
Okay.
However, they still have no accredited master or master level or fellowship
MIU is
level
fully accredited
courses.
university.
So
So they're
it's a work in progress.
So they are going to study there and they'll have the degree and the degree and then they can start.
So for the physicians, they take our fellowship course, which leads to a master's degree. They can then sit the certification exam offered by the American Board of Integrated Medicine, and they can use Ayurveda in their practice. We have other degree programs for undergraduates and a master's program for people who are not physicians, and they can learn some Ayurveda, but they will need to practice under the umbrella of, or along with, a licensed physician.
License.
Dr. Charles, you have been here.
I'm Dr. Charles Elder. I'm the chairman of the Department of Integrated Medicine at Maharishi International University.
And you?
I'm Dr. Leslie Elder. I'm associate professor of the fellowship in Ayurveda and integrated medicine at Maharishi International University.
And your purpose of visit here in Ahmedabad?
The purpose of our visit is to meet people with expertise in Ayurveda, to share our message, and to recruit their collaboration in spreading the word about Ayurveda and growing Ayurvedic practice.
How our government will help you and what the policymakers you need the help from them?
We need help with policymakers to help send us students by funding scholarships, to help us fund research in Ayurveda, and to help us with exchange of faculty.
So what will be your future plans after that?
Our future plans are to continue to focus on training doctors to incorporate Ayurveda into their practice, and in so doing to raise consciousness and to improve the reach of Ayurveda in the medical system.
How Gujarat will be helpful to you?
Excuse me.
How Gujarat will be helpful to you? Gujarat, the state, Ahmedabad.
We've had a wonderful visit, and there's a great deal of expertise and smart people and energetic people here in this area.
Okay, thank you.